Hello everyone and welcome to your channel of pharmacology, where today we will be discussing about a new drug, and that new drug is known as NIRSEVIMAB. So without taking much time, let's begin. So NIRSEVIMAB is sold under the brand name of Beyfortus, and it was approved by the US FDA on 17 July 2023. Now this drug that we have, that is Beyfortus, it is active against the respiratory syncytial virus or RSV. So before we move further, if we look into the structure of RSV, you are going to see that RSV, the lipid bilayer, this is the lipid bilayer of RSV. This lipid bilayer has got a fusion protein or the protein F in it. Now this protein F, it is the target of most of the therapeutic agents which are active against the respiratory syncytial virus. So it's a very important therapeutic target, and this is the therapeutic target for Beyfortus as well. So now what is the role of F protein or the fusion protein? This F protein, it is a type 1 integral membrane fusion protein, and it is important because it mediates the fusion between the viral and the host cell membrane, right? That is, when the viral cell, suppose this is the viral cell and it is going to infect the host cell, and let us suppose that this is the host cell. So in order for the infection of this viral cell, that is for the viral cell to infect the host cell, there needs to be an attachment of the viral cell membrane with the host cell membrane, and this attachment is actually mediated by the protein which is the F protein. Okay. Now the mechanism of action of this drug is that this drug is a, since it has got MAB at the end, that means it is a monoclonal antibody, right? Now this drug is actually a human G1 kappa monoclonal antibody, and it has been produced with the help of recombinant DNA technology from Chinese hamster ovary cells. Now we were discussing about the F protein. This drug is acting against that F glycoprotein, and what it does is that this drug, it inhibits the conformational changes. Now conformational changes of what? Conformational changes of this F glycoprotein. It is going to inhibit that. And why is this conformational change important? Because after the conformational change only will the virus be able to fuse itself to the host cell membrane. That is, this conformational change, it actually helps the virus to attach to the host cell membrane. So if this conformational change is being inhibited, then this attachment to the host cell membrane, it is not going to happen. And if the virus cannot attach itself to the host cell membrane, that means that now the virus cannot establish the infection, because the first step to establish the infection will be to attach itself to the host cell membrane. Okay. So the indications of this drug is that this drug is used for the prevention prevention of the respiratory syncytial virus infection, and it is actually indicated for children up to 2 years or 24 months of age. Firstly, it is indicated for neonates and for infants who are either born or are entering into their first respiratory syncytial virus season. And this season of respiratory syncytial virus infection, it is mostly in the spring and in the autumn seasons. So for neonates who are entering their first season, or either for children up to 24 months of age who remain vulnerable to their second respiratory syncytial virus season. So for both of them, this drug is indicated. Now the dosage. This drug is given as an intramuscular injection. The site for this intramuscular injection is the anterolateral portion of the thigh. This is the site. Now another point, please remember students, we do not use it on the gluteal muscles. Why? Because of chances of injury to the sciatic nerve. That is why the gluteal muscles are not preferred as a site. Now for the neonates and children who are entering their first season of respiratory syncytial virus infection, if the body weight is less than 5 kg, for them we need 50 mg. Whereas if the body weight is more than or equal to 5 kg, for them we need 100 mg of the drug. Okay. Now if the children are vulnerable through their second respiratory syncytial virus season, for them we need 200 mg total dose. That is, we need 200 mg injections to be given intramuscularly. Now another important thing is that for children who are undergoing the cardiac surgery with cardiopulmonary bypass, for them also we advocate this drug. But the condition is that the child must be stable after surgery. That is, we give the drug only when the child is stable after surgery. And the second thing to note is that we give this drug so that the therapeutic levels of the drug is maintained. Okay. So if the child is in the first respiratory syncytial virus season, the first RSV season, for them, and if they have received already the first dose of Beyfortus and the surgery is happening within 90 days of receiving the first dose, then we will go as per the body weight that we have discussed previously. Okay. But if the surgery is being conducted after 90 days, for those children we need an additional dose of 50 mg. This is irrespective of the body weight. So whatever the dose was, additional 50 mg to that irrespective of the body weight. Now if the child is in the second RSV season, for that purpose, and the surgery is conducted within 90 days of receiving Beyfortus, then we need an additional dose of 200 mg irrespective of their body weight. But if it is more than 90 days, then an additional dose of 100 mg is needed irrespective of the body weight. Now the dosage form and strength of this drug. This drug is available in a single dose pre-filled syringe, and the type of syringe that we used, okay, that is known as the type 1 lever lock glass syringes. This is the type of syringe that we use. Okay. The 50 mg, so there are two injections that are available. The first strength is 50 mg per 0.5 ml and the second one is 100 mg per ml. For this one, 50 mg per 0.5 ml, the plunger that we have, that is violet in color. And for this 100 mg per ml, the plunger is light blue in color. So now what are the most important adverse drug reactions? The most important adverse drug reaction is the development of hypersensitivity reactions. This drug is also associated with the development of rash as well as also with injection site reactions such as swelling and hardness. Now some points about the pharmacokinetics of this drug. The bioavailability of this drug is 84%. The volume of distribution for a 5 kg infant, it is 477 ml. And the terminal half-life of this drug, it is 71 days. Now students, we have got a detailed video on bioavailability as well as volume of distribution. The links will be given in the description box. Please feel free to check it out. And if you like our videos up till now, then please subscribe to our channel and press the bell icon so that you don't miss out on any upcoming videos. Now few points about storage and handling of this drug. This drug is stored in the refrigerated form and the temperature is 2 to 8 degrees C. It can be stored in room temperature of 25 to 28 degrees C, but the maximum time up till which it can be stored at 25 to 28 degrees C, it is 8 hours. So that means if we are removing this drug from the refrigerator, we must use it within 8 hours. So that's it for today everyone. If you like the video, then give it a thumbs up. Also share it among your friends. Please do let us know down in the comment below what other topic you would like us to discuss. We will meet you again very soon with more such topics. Until then, happy preparing. Goodbye and take care.